Good morning, everyone, and good evening for those of you who are in different time zones. My name is Qing Gao. I'm the director of the Columbia China Center for Social Policy. Welcome. This is the second lecture in our lecture series this year with the theme Chinese Social Policy from Comparative Perspectives. This is co-hosted by the Columbia China Center for Social Policy and the Weatherhead East Asian Institute. Today, it's my great honor and pleasure to introduce to you our guest speaker, Dr. Feng. To many of you in the audience, Dr. Wang doesn't need an introduction. He's one of the most well-known and influential social scientists worldwide today who study China and how China compares with other countries. Dr. Wang is a professor of sociology at University of California, Irvine, and professor invited at Fudan University in Shanghai. As a sociologist and demographer, Dr. Wang has been studying China's population trends, inequality, and social policy for many years, making significant marks in all of these fields. Dr. Wang's research on China's fertility and aging trends has been influential in shaping the policy discourse about China's family planning and pension systems. Dr. Wang has authored multiple award-winning books and is a contributor to several leading global media outlets. To me and many others, Dr. Wang is a great mentor and role model. I first met Dr. Wang shortly after I received my PhD. He invited me to contribute a chapter to a book. During that process of working together, even as a fresh PhD graduate, I felt Dr. Wang treated me with the same kind of seriousness and respect that he treats other scholars who are often much more senior than I was. He offered feedback and guidance with care and kindness. I'm very happy that many years later, when I was setting up the China Center for Social Policy at Columbia, I was able to invite Dr. Wang to serve as an advisor to my center, and he agreed. Thank you, Dr. Wang, for your many years of guidance and support to me and to the Columbia China Center. In today's lecture, Dr. Wang will first speak for about 45 minutes, followed by Q&A. I invite audience members to please use the Q&A box to enter your questions for Dr. Wang, and please use the chat box to exchange ideas and your thoughts. I hope you're respectful of the speaker and other participants. Let's keep it civil and active. Thank you, everyone. And without further ado, I invite Professor Wang to begin the presentation. Thank you. You're muted.
Good morning from California, and good morning, everyone, for coming to this lecture. Gao Qing or Dr. Qing Gao, you are too gracious. You are an inspiration, so I will not try to waste the time here to return your kindness. I just want to say that you are inspiration, and I have learned, I'm still learning so much from you. So it's a great pleasure to be here for this lecture on this important subject. So what I will do is, I will, as Dr. Gao Qing said, I would first spend some time to summarize the background and a particular study, or actually a number of studies that we approach this issue of inequality, redistribution, especially public transfer, and then we'll open up for discussions. Okay, bear with me. Okay. I don't see myself now. Is this okay? I know why. So I need to do screen share. All right. As everyone is aware of, in the last half century or so, most last 4 decades, China has been a big story in the world, economically, politically, and socially. So there are many ways to sketch a profile of China's changes. Many people have been doing that. One simple way is to do this with 2 strokes. One is both are well known. One is a story of a spectacular increase in its economy and in people's standard of living. Basically, starting from 1980, we're seeing the Chinese per capita income here is measured by with the PPP, purchase power parity, with international current US dollars. Basically every decade, per capita income triples, right? Until I think the last decade has slowed down a little bit. And also the other broad stroke is rapidly increasing inequality. Here on this graph, in the late 2000s, 2007, 2008, the measure of inequality, Gini index, which shows the degree of inequality. This is income, with 1 being the most unequal, extreme inequality, and 0 meaning absolute equality. The level reached close to 0.5, so 0.84 there, and surpassing most countries in the world. So China not only produced an economic miracle, raised people's standard of living, but also became one of the most unequal societies in the world. It's a long story to talk about why inequality increased, and but here what we want to focus is on the part that's after the inequality reached the peak. We see that after the late 2000s, 2008, 2007, 2008, the simple index of inequality, this Gini index, started to level off, even to drop somewhat. The latest studies we've seen, also numbers or confirm to this trend. So what has happened? Why inequality was so high? That we'll leave it for some other discussions. But why inequality seemed to have leveled off and declined? And a major story is the emergence of a new social welfare regime and the increase in Chinese public transfers. And the idea of this particular talk here is to look at where did the public transfers go? And does it have any impact to account for the leveling off of inequality that we're seeing here now? The first decade of the 21st century is quite a transformative century decade in terms of the Chinese public transfer programs. And I should say very briefly, prior to the turn of the century, with Chinese economic reforms starting from the late 1970s, 2 trends emerged. One is poverty in rural urban areas, new kinds of poverty. And the other is a general collapse of the old social welfare systems under the socialist system prior to the economic reforms. So for decades, the major social programs in healthcare, in pension, were in disarray. And the same thing was happening with education, especially rural education. So the first decade of the century really saw major expansions in the social welfare programs. And here we just look at education. Starting from 2001, the compulsory education that's supported by the government with no tuition extended from 6 to 9 years to all students, including those in rural areas. And in health, the beginning of the 21st century also saw the introduction of the rural new cooperative medical system that covers the majority of the population who were left out of the public health program in the countryside. And by the end of the decade, nearly everyone was enrolled in this particular system. And also for those who were not employed in urban areas, the residents, and they were also covered by a separate program. So in other words, by the end of the 2010s, almost everyone in China was covered in some kind of healthcare program. They are still quite highly unequal. Okay, we'll talk about this later on. And the benefits and its contributions are vastly different. And then lastly, for pension, the urban employees, the state-owned enterprises, they kept, and government employees, they kept their pension throughout this time period. But those who were laid off, those who became private employees, and those in the countryside who used to be covered in the communes, basic health, collective health care regimes, they were without healthcare, public healthcare program in the late 1990s. So this is by the beginning of the century. Again, different programs were put out. By the early 2010s, almost everyone was covered by these new programs. Now, these programs are highly unequal. Okay, we'll talk about them later on. But the important feature is the coverage. So by the end of 2010s, beginning of this century, this decade, almost everyone in China was covered in health and a pension scheme, one kind of the other. This is a great achievement. So how was this made possible? Why? There are a number of reasons. First is this concern over rapidly increased inequality we saw early on. And the government was very concerned about the potential social unrest. There was a lot of discussion in the late 2000s on the so-called warning line on the explosive social unrest with inequality. So there was a lot of concerns in the society. And then what's not being quite noticed is a unexpected economic boom. I say unexpected, we can come back to this topic later on. In early 2000s, most people did not expect China would have such a fast economic growth after China entered the WTO in 2001. But the first decade of the 2000s also was the fastest growing in terms of economy, the decade. And what's more important is because it was so unexpected. So the government was taking in money at a rate that was twice the growth rate of economic growth. So GDP growth averaged out about 10%, 11% for the whole decade. But government revenue increase, the annual rate averaged about 20%. So it is this kind of money that allowed China to invest not only in bridges, airports, high-speed railways, and in other areas, but also wisely under the administration of Hu Jintao and Wen Jiabao, who deliberately shifted their policy orientation for social support. And this revenue surplus, unexpected, allowed them to roll out one program after another. So as a share of GDP for on social spending at those three items, as a share of GDP during the decade after this peak in inequality measure, simple measure, doubled as share of GDP from about 6% to over 12% by 2018, the latest we have information. So as you can imagine, China's GDP, the size of China's GDP, also rose enormously during the decade. And at the same time, social spending as a share of GDP doubled. So that's a lot of money that put into hospitals, in healthcare, and in education, and especially in pension. Here, the fastest growing area is pension, right? And that is going to continue to grow. We'll talk about this near the end. So it's notable that many people talk about the Chinese military spending and the spending on domestic stability and maintenance, but the increase in social spending in these areas far outpaced the growth rate in military spending and in spending of domestic stability. So here's a general background that in the last decade or more, China has rolled out, established a new social welfare spending regime. I want to go by this relatively quickly as we have limited time. That is to look at what kind of welfare systems China has. Here, I benefit from Professor Qin Gao's work of many years, who labeled this as a state capitalist welfare regime. And prior to the recent rollout of expansion of social welfare systems, China had a urban-rural segregated employment-based welfare system. In urban areas, the social welfare benefits were delivered through work organizations, work units, whether it was state-owned or collectively owned, which basically included everybody up to the late 1970s. And in the countryside, these social benefits, social welfare benefits were provided through the collective, the people's communes. The benefits differed enormously, but people were guaranteed the basic coverage. There was a promise there. So we all know what happened with dismantling of the people's communes and of the state-owned enterprises, the reforms. A lot of people were thrown out. So what we see now is with the programs I just described, is on the surface, it looks like is a citizen-based, it's a new real social, no longer workplace dependent welfare regime, but in reality, it's what we call a identity-based. That is where you live, what's your hukou or household registration status, and in what sectors do you work, whether you're government or state-owned enterprises or private employee of a business employee, or a migrant labor, your benefits are actually enormously different. Okay, so what do we say? This is a segmented and unequal system. Okay, we're going to see some of this later on. And given that the Chinese economy has moved into what's really a state capitalist economy, it's a capitalist economy. It's making money. So money is capital, and but it's governed and ruled by the state. So and the state, given its concern for rapid increasing inequality, wants to appear to be this benevolent provider. So that's why we say China now is we have what's a new regime, and that is a what do we call it, paternalistic capitalist, state capitalist welfare regime. And that differs really from the typical Western democracy welfare regimes that's being widely studied. And the Chinese case is probably, it differs from the three typical types that's done by Esping Anderson. But it's somewhere between the conservative democracies, and then the government does want to have the support of so-called middle class, especially the urban middle class, and but it's still tied to employment. So the system in China now is a particular kind of welfare regime, and that differs both from its own past and from what we know in other capitalist market economies. So we can have a lot more discussion on this, but I'd like to move on quickly now to what do we do? So how do we assess the outcomes of public transfers? Okay, so methodologically, people have used different methods, but methodologically, there are two challenges, okay, because we have two sources for data. One is through survey data. You ask people in household surveys, you ask people about their income, their expenditure, and also about sources of income, including public and private transfers. Public are those from the government, and private are those from other members of the family and other private individuals. So this has been used, including Professor Qin Gao's early work with Carl Riskin, using the Chinese household income project, the data from there. Basically, you can calculate, for instance, Gini coefficient before adding the public transfers and after adding public transfers. Many people do this, use this kind of method. The challenge here is individuals actually don't know what kind of public transfers they are getting. For instance, they have no idea how hospitals are subsidized. They only can report what they paid when they go to the hospital and how much they got for reimbursement. And they also do not know, for instance, how much the government pays for their education. So the fact that they report very little money for spending on education doesn't mean that they did not receive a lot. So what happens if you add up the survey reported transfers, what people got, they don't add up to government spending. So on the other hand, at the other extreme, we have government statistics, the government expenditure on social spending. So they report numbers. Or governments report these numbers. But the issue is we do not know who they went to, because people do not receive these aggregate government transfers equally. We do not know, for instance, the profiles by age, and also by, to our interests here, by socioeconomic characteristics. So there's no perfect data source and the perfect method to study this. So the results I want to share with you is through a collaboration with colleagues at Fudan University, and also Professor Shen Ke at Fudan University, and also Professor Cai Yong at UNC, here a sociologist in the United States, and others. So we have been working under a consortium to use a different method and try to get to this subject. The particular method is known as the National Transfer Account. So basically it goes like this. We won't have time to digest a relatively sophisticated and tedious methodology, but the idea is, I hope it's simple. So basically we have the government statistics on social spending on these items. And what we do is we combine these government provided total with a age profile or socioeconomic profile that's generated from surveys. So in other words, here we combine the macro and the macro data. So using the micro, the household survey data or other survey data to construct age profiles on income, on consumption, on transfers, and then we match that with a government reported total. Now the process is tedious. There are many adjustments and need to be done, but basically the idea is this idea. I'll show you a number of graphs. And for this particular exercise, we not only construct age profiles for the whole population, but also construct age profiles of consumption, of income, of transfers by the household income quartile. So in other words, we have a very simple way, 4 different groups by their household per capita income. And then we look at what each group, how much they made in terms of labor income, what's their consumption, and what public transfers they received, and what contributions they made. So here, I'll show you some results from the year 2014. That's the latest year we have done analysis. And we compare with 2009. Remember, 2009 was the beginning of the rolling out, the beginning of the decline of this modest decline of income inequality, general measure in China. And so this 5 years is really the beginning years of after the rollout of the pension system and also of the healthcare system. So we know that everyone was covered. So we want to look at how, not only how the transfer was distributed, but whether during those 5 years, we can see whether the transfer has had any impact on the inequality situation in China. All right, so I already went through this and I'm just going to move on. Okay, what is this national transfer accounts? So I want to give a couple of graphs to show how this is done. This is especially relevant to what we talk about a transfer. Here are 2 sets of curves showing the very fundamental nature of human lives. That is, throughout the life cycle, everyone begins as a dependent. Okay, sorry, let me go back a little bit. The green lines are labor income for different kind of societies, from hunter-gathering societies to high-income societies. Okay, and then the orange or reddish lines are consumptions. So at the beginning of one's life, also for the 3 different types of societies, At the beginning of one's life, we begin as a dependent. We cannot support ourselves. So our consumption level is higher than the income level, right? We don't make money. But in the prime working ages, the hump you see here in the middle, we make more than we consume. Okay, people in this age group make more than they consume. And at the later ages, depending what kind of society people live, we become dependents again. Okay, now some of this, so not the secret, but the key measure for human society's survival is to figure out how to move the surplus section on the top to the two ends, right? Some of this can be done by ourselves, by individuals. For instance, people start to save for pension, right? And for income these days. But others you cannot do. I mean, when we were just born, when we're in teenage ages, we just can't, we have to rely on others, family, government, right? Community, churches. The same thing with old age support. We still rely on, if not so much on the family, but on government, on communities. So we need to figure out how to transfer the surplus in the prime working ages to the two areas of deficit in the life course and two ends. So the transfers are can be both private and the public, right? And increasingly in all societies, in most societies in the world, is the public transfer that's playing a large role now. Okay, so with the NTA method, we're able to combine, as I just said, the private information, the micro level survey information with the aggregate data, and to figure out how this looks in the real society. Let's see if I have time for this. Okay, I should run it relatively quickly. I'll basically say, okay, here, look at this graph. This is what's done for China for three time periods, 2002, 2007, 2009. And this is flipped from the previous graph. So the negative numbers are actually surpluses. So the surpluses were going up, getting bigger, and the deficits at two ends, which are positive here, are also getting bigger over time. So let's move quickly here. I think this is easier to see. This is similar to the graph on life cycle deficit, the first one I showed you. And this is for China for the decade of largely the decade and a half from 2002 to 2014. And you see the at the beginning of the life cycle, there's the deficit, that's the spending, and it's getting bigger, especially after between 2009 and 2014, the yellow line dropping there. That's the spending on education, okay? Both private and public. This is not transfer, this is just total. And China, as China getting richer, people getting richer, the surplus is also rising, and especially fast between 2009, 2014. You see this on the top. And at the older ages, the deficit is also getting larger. Okay, so that's a general picture of life cycle transfers and life cycle deficit. Okay, so what do we do? Here's a picture showing how the deficit at the two end was filled. How do we fund the life cycle deficit? And let me see this. Okay, the blue shaped bars is the share of public transfer, and orange or the red lines bars are private transfer. So just use the young ages as example, that for education, mostly for education, also for consumption, private transfer accounts a little more than public transfer, but public transfer is quite substantial, especially during early school years. The same thing here is for old age. That includes both healthcare and also pension. And so the blue share is the public transfer part. All right, now let's go into, in 2004, where did public transfer occur, right? It's here we can see education, there's healthcare throughout, and pension, right, at old age, no surprise. All right, so let's look at the real interest we want to see here is the public transfer by, in terms of its inequality, okay. So what we did here was to look at public transfers in 3 areas: education, healthcare, and pension. And we look at them by income quartiles. So here, for instance, this one, it shows the 4 income quartiles, what they received in public transfer in education. The top line, the purple line, is the transfer received by those among the highest income quartile. So one way to look at this is there's bifurcation between the top income quartile group households and then the rest 3. And the excess transfer, they received more than the other groups, the high income group. It's mostly in kindergarten ages, before age, prior school age, this area, and also in higher education, here, higher education. So we may not have time to discuss how they benefited, but in part, this actually is because high income groups also live in cities, and they live in more, in higher income areas where the education subsidies was handed out. So a lot of the education expenditure was provided by local governments, and so where you live actually is quite important. So, but the bottom line is that the richer received more, okay, in terms of education. So this is healthcare. Again, we see vast difference in terms of healthcare, especially in old ages. Again, the high income quartile households received more in public healthcare. Again, they live in better places with state owned and supported public hospitals, right? They have better, they are employed in better work organizations, and they get higher share of reimbursement. So the results here are quite similar to the previous one. Again, I think same thing with pension, and pension is actually the one that is the most unequal. Okay, so again, you see how the top income quartile compares with the next, and then the rest 2. So I think the general picture here we see is that public transfers as of 2014 were still highly unequal. So the more privileged members of society continue to receive more, right? This should not surprise us. You know, the public transfers will not be able to erase inequality so quickly, right? So the question is, has anything changed? Okay, so before we go into that question, let me just summarize here. And this is, we add all three types of public transfers, education, healthcare, and pension together, and then look at this by the four income quartiles, right? So at almost every age, the better off ones received more public transfers in China. And the education, we'll talk about top and the bottom quartile. The ratio is about 1.2. So that's for every dollar the lowest income quartile group received, the top group received 20% more. And for healthcare, it's 40% more. And for pension, it's 9 times. So it's 800% more. That's the most, the comparison between the top and the bottom. So if we add all this up, the three items, the top and then the bottom income quartiles, the ratio is 2 to 1. So the ones at the top receive twice as much as those, the lowest income, 25%, lowest income groups. So, okay, now we can skip this, okay. So I think this is what's getting to the end of our discussion here. That is whether the public transfers were getting more regressive or more progressive, meaning whether it's getting more equal or less equal. So in one of the studies, we did this for 2009. And so we can compare across these 5 years, 5 important years. So what we see here is we compare with education, with healthcare, with pension. So we use quartile, we use 2009 as the reference, and we use the bottom income quartile as the reference. So for instance, in education, here we're looking at this, for those age 3 to 22, the transfers they got, for instance, in 2009, those in quartile 2, they received, the ratio for them, between them and the quartile 1 is 1.11, meaning they received 11% more. And that dropped to almost the same, to 3.99. But when you look at the highest income quartile, here back in 2009, they received twice as much. And that ratio changed to only 1.4. So this is not because those at higher income groups received less. And it's only because later on we're going to see is those at lower income households actually start to receive more during these 5 years by comparative terms. So in other words, if you look at education, if you look at this comparison for between quartile, among quartile 4 and quartile 1, between these two groups, across these 5 years, inequality in transfers is still unequal. Inequality in transfers dropped. And the same thing with healthcare, right? With the exception of this quartile 2, and especially with pension. So back in 2009, this is when the rural household, a lot of them still did not have pension, and some had very little money. So the ratio they received in terms of public transfer was 53 to 1. So in other words, well, we translate this into RMB, a average elderly, this is 60 plus, received say 60 yuan or $9 per month. And the average urban retiree received 3,000 per month. And that's 50 times difference. So that gap was reduced drastically to only 9 times, but still quite high. So overall, so if we compare between 2009 and 2014, we see that during this period of rapid expansion of social welfare provision in China, inequality in public transfers still exists, still vast, but was getting smaller, so reduced. So here's what I mean when you look at the effect of public transfers. So this is a comparison of the total public transfers of the 3 kinds they received relative to their income, right? And wait a minute, let me see. Yeah. So in terms of income profile, income quartiles, the top one, the blue one, are those at the lowest income quartile. So for them, the money that received from public transfer plays a very important role, much more important than the other 3 groups. So in other words, what we're seeing is that the public transfers did go to these, the most needy ones as of 2014. And also what's important is to look at the age pattern. The areas they received the most important transfers are in early age for children, for education, and somewhat in old age in healthcare and in the basic rural pension. So socially and economically, this kind of transfer pattern has long-term implications, right? You think about education, right? That's where you want to invest. So to summarize, the rapidly expanded public transfer programs in China in the the previous decade did help to reduce inequality. Okay. Now this is quite consistent to other work, including the latest, the newest publication I just read last week, Professor Qin Gao's paper using the more recent chip data and showing that the inequality is getting smaller. But it's important to bear in mind that in absolute terms, the rich continue, the privileged members of the society continue to receive more. So this is quite different from a lot of public transfer programs elsewhere in the world. Okay? And it's only in relative terms, the poor has benefited more. Now that's the similar case in other countries in terms of public transfers. We are running out of time to discuss why do we have such persistent inequalities, not only in general, but also in public transfers, why public transfers are still tilted toward the rich. So we can have some of that to that in the discussion section. So I will skip that. And I want to conclude by pointing to the future. That is the challenges that China would have in continue the public transfer programs and in continue its challenge with inequality. First, the good news, this could be read as good news, is government spending as the percentage of GDP has returned in China to its planned economy, the end of planned economy era. That's about 30%. Now it's close to 30%. It dropped to nearly only about half in mid 1990s. When China was really going through the hard times, the government especially. But now the government spends about 30% of the GDP. So why is that good news? So this is the comparison of government spending as a percentage of GDP put out by IMF. This is 2011. So if you look at the Nordic countries, the government spent about over 50%, right? And even in the United States, the government spends about 40% of, this is federal and local government as a percent of GDP. So China was not quite 30%. So China still has room for the government to collect more money, to spend more, right? Now, to increase taxes, for instance, China does not have property tax, does not have inheritance tax, and does not have capital gain tax. So it's quite pro-capitalistic. It's so pro-capitalistic that it's heaven. However, so China still has a lot of room to collect more taxes to fund the social spending programs we talked about. But at the same time, collecting taxes is never an easy business, right? So we'll see how that's going to play out. But what's going to be challenging is, again, this is with Professor Cai Yong and Shen Ke. We did a projection on the need for government spending driven by, in part, Chinese demographics, is that given the current low fertility and the rapid population aging, if China were to move its benefit, the average ratio, benefit ratio, generosity ratio, to the OECD level back in, I would say 2009. Okay, so we say China can move up its benefit ratio to OECD's level at the beginning of the century by mid-century. Talk about, okay, if China can gradually increase its level by 2050, China should be a rich country by then. So that would mean that these social programs alone would take up 30% of GDP. So population aging and the public expectation of continued provision of social benefits, and especially to equalize social benefits. You can't lower the ones who have better benefits. You can only raise those at the bottom. So by doing that, you can raise the general benefit ratio in society, but together with demographics, it's going to push China to use, by mid-century, that's 30 years from now, 30% of its GDP. That's equivalent to the total government spending right now. So what do we do with and what's called the Belt and Road Initiative, and what do you do with global power? So there are serious challenges by the combined force of demographic change and the imperative of social benefit program expansion. And to give you the last picture here, you saw at the beginning how the government was able to take in at twice the speed as the economic growth rate when the economy was growing at 10% or higher. And this is what happened after that, right? So starting from 2000, the beginning actually of the decade, 2011 to 2012, the growth rate, economic growth rate dropped from about 10% to 7%, and now it's only about 6%, right? The GDP growth. And the government's revenue and spending experienced a much larger drop in terms of the speed, right? And in the recent couple of years, government spending has already begun to exceed the growth rate of government revenue. So the age of abundance, when China had such rapid economic growth and excessive government revenue, that era is definitely over. So China has used, I think, the time very prudently in the first decade of 2000s. This could be a coincidence, but it was, with human efforts as well, to expand public transfer programs, and that helped to some extent to contain or even to reverse the rampant increase in inequality. But the public transfer systems, the regime is still highly unequal, and the pressure to make it more equal it's enormous. It's going to be one of the major, I think, continuing challenges for the Chinese society, especially for its government in the decades to come. So with that, I will conclude. I think I'm over quite a bit. Thank you. I'm done.
Thank you very much, Wang Feng. That is fantastic and so profound to look at these charts and imagine the hard work you and your colleagues put into. I hope the policymakers see these and take them into serious consideration in designing the policies going forward.
So if I may actually inject here a little bit.
Mm-hmm.
Indeed, I think we are trying to get this into policy makers' ears. I know that, again, we don't know how this is actually going to work. I know the Chinese, what's called the Fagaiwei, is the Reform and Development Commission. They are doing the new 5-year plan. They asked for Asian Development Bank to provide some background reports, and one of the reports is authored by one of the colleagues of this NTA program, and most of these results were used in that report. But again, how much of this would get into anybody's ear is another issue. Yeah.
And whose ears? So thank you.